Hello, my name is Dr. Jeff Dodge. I'd like to welcome you to the Rhode Island Mission of Mercy dental screening team. First of all, the dental screening area is probably one of the more important areas because that's how the day gets started for the patients. So basically, our aim is to slide everyone through there quickly and efficiently because that allows them to go to the proper department. We're basically looking for their chief complaint, and we're working from their chief complaint. So we would expect that patients will be asked about their primary concern, what's their chief complaint, what's hurting them, and then we'll try to work from there to formulate a treatment plan for them. The health history we want to review just to see if there's any need for any pre-medication. If there is a need for pre-medication, we will dispense that. In the dental screening area, one of the leads will handle that. We'd like to get an idea of the chief complaint, what really brought them down. Sometimes it's a toothache, sometimes it's a broken filling, sometimes people need their teeth cleaned. We try to specify one treatment. The idea is kind of one and done. So we'll have you start out with an oral cancer screening, then we'll address any issues from there. We don't have, just as far as restorative is concerned, we do not have everything that you might be accustomed to in your office. We don't have pins, we don't have posts, we don't have a lot of those fancy things. Generally, teeth like that are considered non-restorable from our standpoint. If the patient has restorative needs and surgical needs, maybe they have a large cavity in a tooth that's symptomatic, tentative percussion, and then they have a smaller filling that looks to be fairly straightforward. Maybe they're going to need that one extracted and one restored. We try to get that tooth restored first, then they can come back through and see about having that other tooth extracted. Once they see the surgical team, once they see the oral surgeons, then that's the end of their treatment, so we try to do that last. Try to remember we're looking to do one procedure. We try to limit our chair time to 30 minutes. Of course, our exceptions sometimes is 2 or 3 teeth next to each other that need to be extracted. Sometimes that can be taken care of. We're going to let the oral surgery team make that decision. So however that looks to you, if it looks like a large deep filling, just remember again, we're not in our office. We don't have the ability to follow through with these patients. We don't have the ability to place temporary fillings, medicated fillings, and follow up in 6 or 8 weeks. So please keep that in mind. Try to print everything. Try not to use any abbreviations. A lot of different people will be reading what's written there and may not have the extensive knowledge that you do. We'd like you to use blue ink, put your diagnosis down, and indicate tooth numbers, quadrants, anything that might be important. And we'd like for you to please try to sign legibly, because if there's a question later on, we may come looking to ask you. So I think that's the main thing to keep in mind. I think that you're going to, if this is your first time with us, you'll certainly enjoy the weekend. I think it'll be very memorable, and if you're returning to join us again, we certainly appreciate your efforts in the past and look forward to seeing you again very shortly. Thank you very much.